Simply the best. Simply the best. Simply the best. Simply the best. So, we want our complication rate to be 0. That's why we're saying, hey, HAC no. Hey, HAC no. Hey, HAC no. We want our complication rate to be 0. Chrissy from the Cardiac Care Center, what would you do to increase the risk of having a hospital-acquired condition?
Well, I could always not clean the TE probe properly, which would ensure that the patient would have endocarditis.
Chrissy, would you ever do that?
HAC
no! HAC no! HAC no!
And Jared, where do you work here at the hospital?
Patient transport.
So Jared, what would you do to one of our patients here at Crouse Hospital to increase the chance that they would have a hospital-acquired condition?
I wouldn't wipe down stretchers in between each use.
Jared, would you really do that?
HAC no!
HAC no!
HAC no! HAC no!
Eric, what would you do to increase the chance that one of your patients would have a hospital-acquired condition?
Not giving them Lavenox, not using STDs, not submitting them for physical therapy.
Beautiful. What would you do, Colleen, to increase the chance of one of your patients having a hospital-acquired condition?
I wouldn't check their ID bracelets.
Would you guys really do this?
Heck no!
No.
HAC no!
HAC no!
HAC no!
Kate Taffel, I work on 6 North.
Katie, what would you do to increase the chance that one of your patients here at Crouse Hospital would have a hospital-acquired condition?
I'd reinsert a Foley over and over.
Katie, would you really do that?
HAC no! HAC no! HAC no!
HAC no!
Poojan, what would you do to increase the chance of one of your patients here at Crouse Hospital having a hospital-acquired condition?
Oh, I would not wash my hands when I go in the rooms.
Poojan, would you really do that?
HAC no!
HAC no!
Heck no!
HAC no!
I'm here with
Megan Marion, I'm from 5 South. Caitlin Coleman, I'm from 5 South.
Maria Miola, I'm from 5 South.
what would you guys do to increase the chance of one of your patients here at Crouse Hospital having a hospital-acquired condition?
I would sneeze into an open wound. Spit shine the PICC line.
And I'd walk into a patient's room and not wash my hands.
Would you guys really do this?
HAC no!
HAC no!
HAC no!
HAC no!
I'm here today with
Linda Campbell, I work for Vitamin Service.
Kathy and Gianni from Speech Therapy.
Let me ask you guys, what would you do to increase the chance that one of your patients here at Crouse Hospital would have a hospital-acquired condition?
I would walk into the room, I would sneeze, I would pick my nose, and then I would start cleaning.
I would go in and feed my patient without washing my hands or using gloves, and I might even take a bite or two myself.
Would you guys really do that?
HAC no!
HAC no!
HAC no!
HAC no!
So tell me, Tara, what would you do to increase the risk of having a surgical site infection?
I might use a contaminated instrument.
Would you guys really use a contaminated instrument?
HAC no! HAC no!